privatization, and poor quality of care as hospitals try to turn over beds at a rate that is just simply unsustainable and not doable. Thank you for coming here today. We have a few speakers, and without much more ado, I'm going to introduce you first to Paul Moyse, President of QB.
Thank you, Natalie. Sisters and brothers, ladies and gentlemen, we should begin by thanking the Ontario Health Coalition for standing up. As we gather today on Front Street, Health Minister Deb Matthews has time for the Board of Trade to trumpet the McGuinty budget. While we say, Minister Matthews, come on to the street and meet the people of Ontario. We need to say with one voice, we don't accept 1.5% increase for health care. That means health care cuts. We won't stand for cuts to health care in Ontario. No! Ontario, we say today on behalf of Northumberland hospital workers, how can you cut up to 60 staff? How do you cut outpatient services, diabetes services? We want health care, not just in Toronto, but everywhere in Ontario. We also say to Minister Matthews, you can use words like price-based funding, managed competition. All of it translates into a great violation. Our parents' generation fought to create Medicare for all Canadians. You can't place workers in competition for one another so that they drive down wages to the lowest common denominator. That hurts workers. More importantly, that hurts the quality of Medicare, and we won't stand for that. We won't stop following Deb Matthews to every corner of Ontario to say this. We value Medicare. We stand for Medicare. We won't stand for the cuts. No more 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 cuts.
The provincial budget this year announced a 1.5% increase in hospital funding. Hospital inflation is running at 3%. And so what does that mean? Cuts! More cuts! on a hospital board that's supposed to represent the community. How did Jerry Schwartz make his billions? Jerry makes his money by investing in a firm that, you guessed it, manages outsourced services for hospitals. And we must stand together and continue to fight these cuts. Thank you. The four Erie yellow shirts. This is going to be short and sweet before the rain gets us all. But I want you to know, Deb Matthews says she does not close hospitals. Deb Matthews says she does not reduce health care. Well, I say, Deb Matthews, come to Fort Erie and Port Colborne. Yeah! You close my medical bed. You close my emergency room. You close my operating room. I do not have maternity. I do not have pediatrics. Deb Matthews, our hospital is closed. A UCC and a coffee shop does not a hospital make.